Hi everyone, good day. My name is Joanne Singh, Ministry of Agriculture. We are back again for another session of our Facebook Live. I hope you all find this beneficial to you because it's basically a continuation from last week. Thank you. Just a reminder of the layer phases of rearing that I covered last week. We have these phases that we go through in the layer operations. And I'm going to focus on certain phases, common problems encountered. Okay, so we'll start with the brooding phase, which is the first, with the little baby chicks. And in this phase, you find that you have several things that you will see more often than others, right? The first one is mismanagement of brooding, and I will go through that in a little while. We have predators, nutritional deficiencies, and two diseases I chose here because I don't have time to talk about all of them. So the most common ones I'm going to go through. Mismanagement. This is basically a management problem where the normal practices that you have to adhere to are not being done properly, and you end up with a series of problems with these chicks that's depicted here in this slide. And these results from mismanagement lead to poor growth or mortality in your birds, and you end up losing quite a large percentage, if not all. So just to bear in mind that management is number one. Your corrective measures basically is that you have to adhere to certain things. I went through a lot of that in my last session, so we don't have time to go through it again, but I will just touch on the different things that you need to look at. Your space, your heating, your feed, your troughs, your quality, your quantity, your drinkers or waterers, your environmental conditions, and your litter. So good management practices can resolve these problems of mismanagement. The other thing is that you have to be wary of predators. Especially in our country, we have a lot of these wild or stray animals that are looking for easy food, and they can enter your brooding pen and just basically massacre all your chicks, if not all, a large percentage, because it's easy food. So what do? You need to make sure that these predators don't get to your chicks. Of course, you have to be wary of your good management practices again. You have a secure fence around the house, and your partitions around these chicks supposed to be sturdy and secure. And good biosecurity measures as well can help you resolve your problems. There are certain nutritional deficiencies that you will see more in these chicks than the older birds. So I'll talk about them here. Now, one of them is the vitamin E deficiency, and the disease is referred to as crazy chick disease because the chicks, they have incoordination in their gait and they can't walk sometimes. And how you resolve this is that you make sure that you have proper nutritional balance in terms of your vitamins in your feed. So you supplement with your vitamin E, or you also look at your feed that you're using and correct it. Another one you see is the vitamin B2, and this is called curly toe because the toes curl up like in the picture you see in here. And again, you look at your vitamin profile in your feed, and if you need to supplement, you supplement accordingly. Another one of the diseases that you will see in the brooding is omphalitis. It is the infection of the navel or the yolk sac. Basically you would see unhealed navels, and that is a port of entry for microorganisms or bacteria to infect. You will see in these cases that the environment is often unclean, and then it stresses out, or you have immunocompromised birds resulting from that. The infection is a very opportunistic infection, which means that when the conditions are right, these bacteria will proliferate and cause injury or harm. All right. What would you see in a bird affected by this? You will see navel inflammation, you will see a reduced appetite, depression, reduced growth, and death. Your antibiotic treatment at this stage is often ineffective, so you need to take preventative measures, and that includes your sanitation and your good management practices. So this is just showing you what it will look like in a chick affected with the omphalitis, the infected navels. So what do? You practice your GMPs again, good management practices, good sanitation, good biosecurity, and you will be able to resolve your problems. That's future problems, because when they have it, there is really no effective treatment at that point. Another disease is aspergillosis, and it is caused by a mold. Young birds are more susceptible to this. And how do you get that? Is inhalation of fungal spores from contaminated litter, feed, environment, or even from the hatchery. And you would see your birds exhibiting signs such as gasping, difficulty breathing, weakness, decreased appetite, and of course, you will see mortality in your younger birds. The treatment options are extremely expensive. Sometimes it might be more expensive than the birds themselves. So it's up to you to decide what you would want to do. No practical treatment is available. So what we advise is that you remove and cull all clinically affected birds from the flock. And you remove all your moldy litter, replace with clean, fresh material. You can treat your litter with a fungicide appropriate for the birds or copper sulfate solution. You can get further advice on this from the PSU. And you ensure that your feed that you're feeding does not have mold. You practice good biosecurity and of course your GMPs again. So we'll move on to the growing and the laying phases now, because I need to cover a lot in the session and I just have limited time. So the common problems you will see here will be cannibalism, nutritional deficiencies again from different ones, and some infectious diseases and environmental insults. So we'll start with this. This can be a very, very severe problem in birds growing and even laying. It is really picking, vent nipping, fighting, feather picking, that kind of thing. And why? Why does it happen? Because you might have an overcrowding problem and the birds are uncomfortable. You might have inadequate nutrition. You might have the presence of injured birds in the flock, and the presence of the blood triggers that from other birds picking. Even excessive lighting might cause it a stressful environment. And this can be seen in all phases. So what can you do? Well, you can debeak your birds from as early as brooding stages, so they don't have the mechanism by which to pick at each other. Or in the pullet phases, growing or laying, you can even put a device on them called spectacles. I don't have time to really get in details, but there's a device that you put onto the bird and it prevents them from nipping at each other, right? Some people put a distraction or an enrichment in the pen. If you have smaller pens, and this is possible, you can.
Do we need to restart so you can get back in? Nobody is seeing the slides. Restart it, yeah.
Okay, so I was just told that we have some technical difficulties and I have to restart the presentation. So just give us a few moments before we could fix it. Hi, sorry for the inconvenience, but we experienced some difficulties there. I'm going to start from the slide that I stopped. Well, it stopped showing it. So I'll continue from now. Mismanagement, we were talking about in breeding. So what I was saying is that good management practices, in terms of looking at your space, your heating, your feed troughs, your quality, quantity, all these things, if you adhere to the correct practices, these things can be resolved and resolve your problems. So the next thing I talked about was predators, and this is just showing some different animals that could get to your birds and use them as food. So what you do to prevent this from happening, you can make sure that you have secure fencing and house partitions around these birds so that nothing could get in and get at them. And of course, your good biosecurity measures, of course, to keep away these animals from coming around, and your good management practices, of course, always there. So there are some nutritional deficiencies as well, which you see more in brooding phase rather than the other phases, and I'll go through those now. One is vitamin E, which is crazy chick disease, where the birds lose coordination in their stepping and how they move around. And it is as a result of inadequate vitamin E in your feed. So what you do is you correct this whole situation by supplementing with vitamin E or looking at your feed, your ingredients in your feed, and see if you are meeting the requirements for vitamins. Another one is vitamin B2. And this one causes curly toe disease. And you can see it here where the toes are actually curled in. And it creates these problems with these birds. And of course, when you detect this, you can correct it by adjusting vitamin B content in your feed as well. One of the phase is omphalitis, and it is essentially an infection of the navel and or the yolk sac. How it happens is from contaminated environment or bacteria in the environment enters the unhealed navels and cause opportunistic bacterial infection. What you see there is navel inflammation, reduced appetite, depression, all of these signs here. And eventually they die. Antibiotic treatment at this stage is often ineffective. So you have to take a preventive approach, and you have to have proper sanitation and GMPs and biosecurity in order to prevent this disease. So this is what you can see when you have an affected chick. The navel is infected like this, and then you know that you have a navel infection. So how can you resolve it? Well, as I said, you practice good management practices, you have good sanitation, good biosecurity measures, and you make sure your birds are comfortable. So no stressful environment. That comes under your GMPs. Another disease that you see is aspergillosis, which is caused by a mold, and it happens mainly in young birds. They are more susceptible than the older birds, and it is transmitted via the inhalation of fungal spores from contaminated litter, feed, hatchery, or environment. You would see some signs with respiratory incompetence here, and you would, once you determine that you have mold around, then most likely your bird will be suffering from aspergillosis. Of course, confirmation can be helped when you consult with your vet, or you can call us, the PSU, to help with that. How do you treat? Well, treatment options for aspergillosis is very, very expensive. Might be more expensive than the birds themselves. So you have to make up your mind what you want to do with your flock. No really easy or practical treatment is available. So what we advise is that people cull and remove the birds from the flock, remove all your moldy litter and replace with clean, fresh material. You can treat your litter before with fungicide or compost sulfate solution. Further advice on that can be given from the PSU as well. And you ensure that your feed is not moldy, and of course your GMPs and your biosecurity always there at the end. So I'll move on to the growing and the laying phases because we don't have much time to really go into detail in a lot. So common problems that you see in these phases will be cannibalism, nutritional, infectious diseases, and some environmental insults. So this problem here can be a very serious one, and it is essentially birds picking at each other. So you have vent nipping, fighting, feather picking, all that, and it causes the birds to bleed, and there's a vicious cycle that emanates from that, with they looking at each other and picking around in the flock. So what can cause this? Well, see, once the birds are stressed, it will be putting pressure on them, and they will start, adopting abnormal behaviors, and this is one of them. So if you have inadequate space or overcrowding, you have inadequate nutrition, you have presence of injured birds in the flock and the sight of blood, bright light, stressful environment. All of these things can trigger this behavior. What can you do? Well, as I said in the last session, you can debeak at the birds at as early as 7 to 10 days old. So you get rid of the mechanism of the beak picking, being able to cause that kind of injury. Since in early stages, you can do that. If you still have the problem at the growing stage, you can use something called spectacles. And this is a device that is put onto the bird, and it prevents them from doing the same picking and nipping at each other, right? Some people, if they have a pen that they can use an enrichment or distraction method, people put in like bundles of grass or vegetables or things like that are beneficial to the birds, but they will be distracted from actually going at each other and attack these things instead, because it helps them to sway away from picking at each other. Of course, your GMPs are always there because they always help with these things. So again, so you can debeak very early. You have optimal nutrition, you have good GMPs, and you can put distractions in your chicken house. Some of the nutritional deficiencies that you will see in the later stages would be vitamins and amino acids or protein. So one of the most common ones you'll see is vitamin D3, and it causes the inability to stand, and the legs are basically soft and pliable. You have decreased egg production, soft shells, and your administration of your vitamin D3 along with calcium and phosphorus can resolve this. So again, you have to look at your nutrient profile in the feed that you are actually feeding these birds. Another one that you see fairly commonly will be proteins and or amino acids, and you would see poor feathering, poor growth, possible feather picking and cannibalism. You'll see from this reduction in egg size and number because it's proteins. Of course, you look again at your feed of what you're giving them. You can supplement with amino acids. There are lots of commercial preparations available. And of course, you look at your crude protein content in your feed. I covered all of this in the last session, so I can't go through any of it here right now. Right, so we move on to environmental insults. These things are again related to your GMPs. So you're looking at your temperature, your humidity, your ventilation, your litter management, water supply. If there are any toxins around, your stocking density will be your number of birds in your space that you have, right? All of these things, if it is not adequate, if they are not adequate, they can influence stress into these birds. They come down with something called heat stress. They impact the health and well-being of the birds. They can result in the immune system being suppressed and opportunistic infections where the conditions create ideal environment for bacteria to proliferate, and of course ends up in your mortality. So all of these things are so important in trying to prevent your birds from becoming compromised. So what are infectious diseases that do you see in these phases? This slide is from a previous presentation I did, one of my first ones, and it is just showing you again all these organisms that cause these infectious diseases. So I'll just go through a few of them here, which you may see when you start your operation. A very common one is coccidiosis, and it is caused by a protozoa. All ages of the birds are affected once they after 1 week old. It's transmitted via contaminated environment or feces with the organism, right? So you see signs. A lot of these signs will be similar in all of these different diseases. It's just that you have to zero in on what is the cause and what is really causing all of these symptoms. So if you do a postmortem on the bird, this is part of the intestine here, and you are seeing it's very hemorrhagic. And this is one of the things that can tell you that it is coccidiosis you're dealing with. And of course, there's the diarrhea that you see in the pen. Your treatment, you can use anticoccidial drugs. For example, these two that I have here. And then if you have secondary bacterial infections, you can put them on antibiotic therapy. Of course, your sanitation and biosecurity are paramount to help controlling this. Another one that you might see is necrotic enteritis, also caused by a bacteria, Clostridium bacteria, and it is a normal inhabitant of the intestine. But when there's a change in the conditions, then an opportunistic infection can occur. So you don't want that to happen. And these conditions, well, they are basically your GMPs again, creating stress in the bird, and then you find that the organism will proliferate and cause this problem. So you're seeing necrosis of the small intestine mucosa here. So this is one of the things you look for on postmortem as well. And you see in the same kind of signs like the coccidiosis. So this one, you can actually use antibiotics. But of course, to prevent this, you stick to your GMPs and so on. This is colibacillosis, which is E. coli. I'm sure a lot of people are familiar with E. coli, and this bacteria can cause a lot of problems for you as well in your birds. Again, it boils down to your good GMPs and sanitation. This is just showing what you can see when they have affected depressed birds, and you can even see an inflamed navel or omphalitis at this late stage. All right, so we'll go on to endoparasites, which is a fairly common situation that you encounter with birds that you keep in for table eggs. And there are different types of worms that you can be affected with here. This is just showing a picture of the round ones, and this is the tapeworms. So how do you get these worms? The direct ingestion of the eggs. And these eggs can come from different animals, like maybe darkling beetles, insects, snails, earthworms, even wild birds. So it all depends on how secure your pen is. What do we see when your birds have worms? Basically, it's the same sort of things that you can see again. You may see some diarrhea, you may see decreased weight gain, intestinal impaction, morbidity, mortality, and of course, there are lots of treatments and programs that you can devise to make sure that your birds are not affected by these worms. You can get more advice on that from the PSU as well. There's also ectoparasites, which are the ones that are found on the outside, in the feathers, on the skin, right? So you have mites, body mites, you have lice, fleas, ticks, flies, and all of these things are also transmitted via other birds, animals, contaminated litter, environment. Again, your biosecurity will come in here again. So your clinical sides, you'll see a lot of discomfort in the birds. You'll see skin irritation, the scratching, the uncomfortable with the feathers, ruffled feathers. You will have loss of appetite, weight loss, because these parasites are basically sucking the blood out of these chickens. So you would have anemia and weakness and eventual death. How do you treat? Well, you can spray or mist the environment with appropriate agents. You can also use systemic drugs, they're available. And there's also, again, sanitation, biosecurity, and it comes down to your good management practices again, which I did in the first part of this. There's another disease that I want to talk about here. It's called Marek's disease. It is caused by a virus, and Usually, day-old chicks are vaccinated at the hatchery. Sometimes, if these chicks are not vaccinated, like for backyard flocks, you would find that contaminated litter, dust, or dander can transmit this disease to your birds. It's mostly seen during this time period, 6 to 30 weeks old, and these are some of the signs that you can see if they are affected by Marek's disease. Depression, paralysis of the wings and legs is a very important one, limp neck, and you will see respiratory distress or gasping, incoordination, and of course death. And you see a high mortality percentage in your flock if this happens. There's no treatment, so the control is really by vaccination and biosecurity measures. Foulpox is another one that is caused by a pox virus and is transmitted directly from bird to bird, or mosquitoes and flies could be vectors of the virus, contaminated feed and water, and they can affect all ages except the newly hatched chicks. So how do you know? Well, first you will see like lesions on the comb, the wattles, the featherless areas. You will see like blisters or lesions, could be dry and crusty. And then there's the wet foam also, that you can see these cheesy, yellowish, wettish lesions inside the oral cavity as well. Easiest way to look for them in your birds. There's no treatment for this. You can get secondary bacterial infections, and those can be treated with antibiotics. But your control measures, again, will include proper biosecurity measures, and there's a vaccine available for this. So if you vaccinate your birds, most likely you're not going to come down with this. It's also a self-limiting condition, but it affects your production greatly in terms of you lose a lot of production during the time that you're affected by this and recovery. So we move on to laying hens. I'm just going to go through two major ones here. And your major problem with laying hens is that your egg production drops, and you want to know why. So two reasons I will go through that could attest to this drop in egg production or quality. One is egg binding, where the hen basically is straining to produce an egg for more than a few hours. So she's trying to lay and she can't get the egg out. So the egg is stuck in the reproductive tract or the oviduct, and she can't get it out into the open. So why? Why does it happen? Well, you might have an imbalance of calcium, so-called hypocalcemia, and then there's something called calcium tetany, where you get muscular tremors from the calcium imbalance, and you don't have proper muscular contraction, so the egg cannot be laid. And she's trying, but she can't. So if you have old birds as well, or if you have very young birds and they start laying before time, you can have that problem as well, or even obesity, or if you are producing very large eggs and they can't pass mycotoxins. Some mycotoxins can cause the problem as well. And of course, if there's stress on the bird or trauma to the reproductive organs, you will find that you have that problem as well. How do you know that the egg is there and it can't come out? Well, you will see some abnormal behavior in your birds. Abdominal straining is one, or distended abdomen, right? You will see the tail wagging a lot. You will see depression. They will not perch because it's uncomfortable for them to fly on any kind of perching or perch that you would have in your pen. They will have a wide stance. They're sleeping on the ground instead of perching. You will see respiratory distress, paralysis of one or both legs, because the egg is basically suppressing some nerves and muscles on the legs. And then you will see cyanosis and death, lack of oxygen causing cyanosis and death. What can you do? Well, emergency treatment may include very simple things. You use a dark room or switch off the lights because you want the bird to be comfortable. There's lubrication of the vent area. You can massage gently with olive oil. And there's also warm water bath and a relaxing environment. And of course, the last thing, surgical intervention. Now, these maybe you will look at for birds that are very expensive or your prized possessions. People with just a farm may not even bother with this. But if you do try to help to try to get the egg out, you make sure that you do not break the egg while you are massaging or trying to get it out, because this will be fatal to the bird. All right. Sorry. Yes. Prevention and control. Of course, your GMBs again. Do not use excessive lighting. Make sure you have a balanced mold-free layer ration. And a calcium supplement such as oyster shells is recommended because it will be available at all times to the birds, and they take as much as they need. They have instincts as well. So if you have that all the time as available to them, it might just solve your problem of egg biting. And then the stress-free environment is paramount because stress triggers something like this. Another one is egg drop syndrome, where there's a sudden drop in production of your eggs, as well as your eggshell quality in apparently healthy laying birds. So you're not seeing any other problem at all. All you have is this sudden drop in production or drop in the eggshell quality. And you're wondering, well, I'm on par with everything else, so why is this happening? Well, it is really caused by a virus, and it can be transmitted vertically from bird to the egg or bird to chicks. Also, contaminated egg trays and equipment can transmit this virus to the bird, and insect vectors and wild birds. It can be transmitted from bird to bird, but that is a lot slower than these other forms of transmission. So how do you see what's going on here? Clinical signs. They begin at sexual maturity. So the bird could have this virus from way back since it was a chick, and you never see anything until the bird begins to lay. You will see that your flock is failing to peak or drop at peak production with your egg production levels. Right? Up to 50% a drop in reproduction you can actually get from this. Right? You see a loss of pigment in the shells. You get soft shells or shellless eggs. So the egg is being laid, but it don't have much of a shell. Poor internal quality of the eggs, and you get a very small egg. So how do you prevent and control this? There's no treatment available, but there's sanitation and proper hygiene from the beginning. Disinfection of egg crates and equipment that you are using over time. And you have to have clean, potable water, your biosecurity. And vaccination is available depending on your local situation. So more advice can be given on that if you need advice from the PSU. Other diseases of importance I touched on in my last presentation: Newcastle disease, infectious bronchitis, and infectious bursal disease, Gumboro. These I will not go into detail because they are vaccinated for in Trinidad and Tobago. And I also put up back the same guide that I had the last time to show you the days that you look at and which disease that you are vaccinating against. As you can see, Marex is here as well, which is at the hatchery. And fowlpox is also here because that vaccine is available. And it can be done via these methods, and we can show you how to do these things if you are not sure once you give us a call or contact us for assistance. Right, so this is just a recap on the vaccination. So I will just reiterate, if you need assistance, you can call us at the PSU, and I have the numbers here again, and our email address. If you want to email us with a problem or send any pictures or anything like that, you can do that, so we'll be able to help you further. And that's all I have for today. I thank you for your time, and if you have any questions, I'll try to answer some of them now. Oh yes, these apply to white chickens as well. Of course, not the egg part, because we don't keep the white chickens to lay eggs. So those are broilers. So all of these things will apply. It's just that it is more applicable to our layers because we see them more in layers. Domestic or farms, which is most affected by these diseases. Farms are more affected by diseases because you have a large number of birds, and transmission is easier when you have large numbers of birds, but it's still possible in small backyard farms as well. All right, and the last one is how many birds put in a 10 by 23 space. Okay, so I have those specifications in the last presentation where I stated what you do for brooding, what you do for growing, what you do for laying, right? But when you have layers, you are aiming for 1.5 square foot space per bird. So you will have to look at your space and see how many birds that could 10 by 23. I'll have to do some calculation there, but you're looking at 1.5 square feet per bird. So you can do a little simple division there and figure it out. Any more questions? Right. Right, so if you have, okay, so it's about 153 birds that you might be able, so 150, fine. So, any more questions? Okay, so that's all the questions I have, and feel free to post up your questions online as well, where we can go back and look at them and answer them on the chat. Thank you very much for viewing, and hope to see you next time.